Crohn's disease is a type of inflammatory bowel disease. It causes inflammation that can occur throughout the entire digestive system, but its highest prevalence is in the ileum or colon.
Inside the small intestines, Crohn's disease causes a narrowed lumen and thickened walls, abscesses, and a cobblestone appearance.
The cause of Crohn's disease is unclear. Genetics and environment are thought to play a role, but many experts believe it is an abnormal immune response to bacteria or specific foods.
In people with Crohn's disease, these bacteria and foods can cause a buildup of white blood cells in the intestines, which leads to inflammation.
The symptoms of Crohn's disease include diarrhea, rectal bleeding, urgent need to move bowels, constipation, fever, fatigue, night sweats, loss of menstrual cycle, abdominal pain, anemia, skin problems, arthritis, a loss of appetite, delayed growth and development in children, and weight loss.
Many strategies are used to treat and control Crohn's disease. 5-aminosalicylates help relieve inflammation in the colon. Corticosteroids and immunomodulators help by suppressing the immune response. Biologic therapies utilize antibodies that can stop certain proteins from causing inflammation. Surgery can be used to remove the diseased part of the intestines. Bland food can also help relieve symptoms.
Many nutritional interventions have been looked at for Crohn's disease. In this video, we will examine the efficacy of omega-3 fatty acid and vitamin D supplementation specifically as a potential treatment for Crohn's.
Omega-3 fatty acids are thought to protect against inflammation by suppressing pro-inflammatory cytokines and promoting anti-inflammatory cytokines. Can omega-3 fatty acids be used as a treatment for Crohn's disease?
A double-blind, block-randomized study by Nielsen et al. Gave participants either an omega-3 or omega-6 treatment to observe their effects on pro- and anti-inflammatory cytokines. Basically, the results were inconclusive. Some limitations of the study include it wasn't multi-centered, there was no diet data, and the omega-3 treatment also contained other ingredients, including omega-6 fatty acid. Overall grade, a C.
A double-blind, randomized multi-center study by Romano et al. Looked at omega-3 fatty acids and disease relapse in pediatric CD by treating participants with either 5 ASA plus omega-3 capsules or 5 ASA plus placebo. They found lower relapse rates in omega-3 group. Some limitations include high dropout rate in the placebo group and no diet records. Overall, grade A.
A multi-center randomized controlled trial by Fagan et al. Indicated that omega-3 fatty acids were insufficient in controlling or preventing the remission of Crohn's disease compared to a placebo pill. There were no significant limitations for the study. Overall grade, an A.
6 randomized controlled trial studies were analyzed by L.G.M et al. To determine the effects of high-dose omega-3 treatment. Researchers concluded a high-dose treatment of omega-3 treatment to be ineffective in preventing a remission of Crohn's disease. Because results are inconclusive and one article was graded a C, the overall grade for omega-3 fatty acids is a C.
Vitamin D is a steroid hormone that has potent immune-regulating properties. While small amounts of vitamin D can be obtained from the diet, largely from fatty fish, the majority of vitamin D is synthesized in the skin in response to sunlight exposure. It can also be taken as a dietary supplement. Is this effective as a treatment for Crohn's disease? A randomized placebo-controlled study published in 2015 by Raftery et al. Looked at the effect of vitamin D supplementation in 27 adults with a confirmed Crohn's diagnosis. Vitamin D therapy improved quality of life and maintenance of intestinal barrier integrity while reducing markers of inflammation. The study had one minor limitation in that it was a pilot study with a low sample size. Overall grade, A.
In Pappa et al., the study was not a blinded, randomized clinical trial. Both groups were taking vitamin D2 with different dosages. The results were vitamin D2 levels in the blood were not different between the groups, and inflammatory biomarkers were better in the group with a higher vitamin D2 dosage. This study was not blinded and had some limitations. For example, the lack of a placebo and the use of a vitamin D2 supplement, which is inferior to D3 as indicated by previous research. Overall grade, a C.
In Jørgensen et al., the design was a double-blind, randomized control trial looking at vitamin D3 supplementation in patients with Crohn's disease remission for 1 year. Relapse results were inconclusive. Some secondary biomarkers were measured and showed better immune function in the vitamin D group. This study had a few minor limitations. Because only 20 of the 94 patients relapsed, it lacks statistical power. It's also important to note that their study population consisted of patients already in remission. Lastly, the choice of calcium in the placebo group limits the translational potential of this research for supplementation with vitamin D3 alone. Overall grade, A.
Based on the 3 research studies we reviewed, we give vitamin D an overall grade of C in the treatment of Crohn's disease. So what do we conclude? Both omega-3 and vitamin D are well tolerated and show some promise in the treatment of Crohn's disease, particularly for their immune regulatory properties. However, the studies reviewed here show that their efficacy as dietary supplements are inconclusive. More research is necessary to determine if it is worth including these nutrients in a treatment protocol for individuals with Crohn's disease.